Good morning, everyone. It is Tuesday, May 17th, and this is Shankar Ponsley with the Shanks Show. I think today we'll be joined by Andrea Ferguson, who is going to be a little bit late, but that is not a problem at all. I hope you're doing fine. I hope everything is all right. And Andrea and I, we thought we would talk a little bit more, not too much, but just a little bit more about Alternative Nation, which was the conference that we attended last weekend. And that was in, let's see, Fort Worth, Texas. By the way, who has ever been to Fort Worth and was just absolutely surprised what a beautiful city that is? I heard that it was completely leveled due to a tornado a few years ago, and then they rebuilt the downtown center, the downtown area, and I have to say they did a fantastic job. However, as a vegan, it wasn't very easy because Fort Worth has the nickname Cowtown, and that means you get steak and beef on every corner. But I will have to say that they were very accommodating for our vegan palates. So I think what Alternative Nation did really well with the lineup of speakers, the organizer, obviously the leaders of the Free Market Medical Association, and most specifically, I believe Lynn Henderson with connections. She was really at the helm of everything. Uh, the organizers did a fantastic job in sourcing speakers that had a lot to contribute in the different fields. Some were clinical approach, some were from a legislative approach, and then others were in the arena of organizing healthcare from for example, a TPA approach. So all these different approaches were represented, and really one of the most difficult aspects of fixing healthcare in this country is shedding light on its complexities, understanding why certain prices are. Whoop, that is Andrea. There she is. Good morning, Andrea. People have been waiting for you.
I had no idea that I was entering the room right now.
Oh, you hadn't?
I did
Well,
not.
well, they get the real Andrea. So I was just saying what a nice eclectic group of speakers they had from all different angles. They approached the topic. That is very important because healthcare is intentionally made a little bit difficult to understand in terms of how cost is put together. And yeah, so one of the most interesting aspects to me was the that even in this purist movement, it's not a purist movement, even in this movement that is really geared towards doing something new in healthcare, you had like extremes within the ecosystem. And that doesn't mean that the word extreme here was bad, is to be understood as a bad thing. But there was specifically one gentleman that really stood out to me, who was just really wanting to go back to the basics, if you will, in terms of healthcare and the doctor and the patient relationship. So he said, I really, really want to make sure that there is only a doctor and a patient and nobody in between, that manages us, that organizes us, that tells us what our rates should be. And yeah, so let's see. We have a few comments here. Friend of Andreas.
Hi, Eddie
Mm,
Cleany.
awesome. So, Andrea, what stood out to you this year at the conference?
There are a bunch of things that stood out to me at the conference. I think I'm always, like you said, blown away by the lineup of speakers. And then, of course, following in the honor of, Tony Dale, Dr. Tony Dale, to receive such an award, the highest award you can receive in that organization for um, all that we do for the chapter. It's really awesome. And I think what I realized was that everything that we do in our line of work really does line up with the free market, from helping to develop case studies and obviously doing the member highlights and all of that. But what we do in our business in the healthcare vertical really does support DPCs, because, and we know direct primary care, it is not free market, but it pairs well with free market because there you're removing the barriers between the consumer and the buyer. So everything that we do to make that clear, whether it be to help a doctor understand why they need to market themselves because they don't understand that they're sellers of healthcare. If you'll remember, when we had our first meetings, everyone was tripped up on the paperwork of which box to check
Mhm.
because it just wasn't natural to think of healthcare as a good or product to sell. So it was it was kind of, again, I always say that full circle moment of, standing up there at the bright lights looking out at everyone who we help to make their message clear about what it is that they do as sellers. Marketing is really important in the free market.
Mhm.
And I think if nothing else, that the closing speech by Dr. Keith Smith really helped to make that clear too, about the checks and balances in medicine. Like, the scales are not even. It is tipped in the favor of hospitals and just kind of these big corporations who can kind of do what they will with medicine. And giving some ownership and empowerment back to the consumer was really sort of what I took away from that, and the importance of getting that word across.
Mhm. Now, you said direct primary care is not the free market. What did you mean with that?
So, um, well, they're not synonymous, but
Mhm.
the one goes hand in hand with the other.
Mhm.
So you don't have to be like a direct primary care to operate in the free market space. Really, what we're trying to accomplish is just bringing down like stimulate competition and bring down the price of healthcare. And you can do that outside of direct primary care models. There were a bunch that were listed, and none of them, of course, are popping up in my head, but there's ways that you can participate in supply and demand in the healthcare side without necessarily being a DPC.
Mhm. Okay, well, if you are a healthcare provider, as some call you, even though a lot of uh, doctors and physicians who are very proud, as they should, about what they have achieved, don't really like that word healthcare provider, I have heard, because it really kind of removes that notion, that it basically puts them at the same level as nurses and other healthcare providers, right? So we
Even
will,
hospitals, right?
yeah,
Like, they're
yeah,
technically providers, and that's an
hmm,
example of, you don't have to be a DPC to practice free market. You could just
right,
display your prices on your website as a hospital, but they're
right.
technically providers, if you will.
Yeah, so when we lose that term, it's kind of loosely, and we just, the thing is, I catch them say it themselves. It's just one of those words that have become part of the vernacular, and but so let me go back. When you are, if you are a healthcare provider and you are interested in marketing yourselves, learning how to do that yourselves versus paying us or paying another agency to do that, I actually have a webinar coming up tomorrow night, I believe at 6 p.m. I think I'm going to blend in an address for you to look at. So shanks.healthcare. It's a live webinar. It's for free. And during that webinar, I'll attempt to teach you the basics of marketing yourselves until you get to the point where you can afford someone like us. Yeah, the other aspect that I wanted to bring up is our Shanks Club, but I'm not sure if Andrea wants to give us a final thought before she needs to leave.
I mean, I would just say if you haven't attended a conference with FMMA, you don't have to be, I mean, you don't have to be a doctor to get, it's not a doctor's club, and you don't have to be, you know, us. You can go out of curiosity. I think the more people we have in that space that just understand how to operate as a consumer, the better. And of course, especially if you're an employer, you'll get a lot out of it too. But if you can't do that, or if you're looking for something in between now and a year, then you should really come to our local chapter meeting in June, and we'll provide more information soon about that. But also just keep watching to understand. If it's too overwhelming, you just gotta make an attempt, and don't be afraid to invest some time in something that's really gonna change everyone's lives for the better.
Yeah, and the meeting in June, by the way, is virtual, so you can attend from wherever you are. All right, thank you. I'm going to talk a little bit about the Shanks Club, and then we're done for today, I promise. The Shanks Club is a $7 a month membership with which I send you a daily prompt, very targeted prompt for you to answer on social media so that you can gain more followers and gain more impact. The other part of Shanks Club is I will release weekly training videos, about 10 minutes long each. And also you get access to super discounted software deals, usually lifetime fee. So you pay once and you use forever. I have prepared a short video clip about that. And after that clip, we will wrap this up for today. Thanks for checking in here with the Shanks Show this morning.